Hi guys, welcome back to RT Share Tea, where respiratory therapists live out loud with me, your host Linda Fry, the Asthma Lady. Yes, thank you so much for returning to my regulars, and thank you to anybody new that is just joining us today. Okay, so I want to say thank you to everybody hanging in there with me for Asthma and Allergy Awareness Month. We are at the end of the month. So thank you so much, guys, for joining me. And I hope that everything I've been sharing with you this month, you have found useful. And I hope that is inspiring you to get out there and do this work. Know that, with COVID and everything that's happening, we don't know what these lungs are going to look like. So we need folks that are, just up to date, proactive, and that can really help patients that are suffering with diseases like asthma. All right. So that's just my PSA on just, keep investing in yourself and keep learning. And I really believe in that because that's what I do. All right, guys. So thank you so much. Please remember to like, share, subscribe to us on YouTube and Google Podcasts. We are on Google Podcasts every Wednesday, and we are on YouTube every Thursday. Google Podcasts at 6 p.m. Eastern Time. We won't be here next week because Linda needs a vacation. So we're going for a quick getaway. I've had a very busy and productive month. It's a good problem, okay? So I'm not going to complain about being busy. But yes, so today's episode is about how to use motivational interviewing skills with asthma patients, okay? So I recently did like a little snippet for TikTok and for Instagram on motivational interviewing, just showing a very simple, like, how to use it. Okay, so motivational interviewing is a counseling method that folks use to counsel people, right? So therapists use it, and other professionals, health professionals, they use this. So basically this helps to do like the detective work. So it's not like your intake sheet where you're just trying to get information. It's more in depth, and you're also trying to build a rapport with the patient by using motivational interviewing. So motivational interviewing are open-ended questions. They are questions where the patient is not just saying yes or no or fine or whatever. We are actually digging deep to find out what's going on, the history. So a lot of folks will be like, well, they'll just start with the questions. And I'm going to tell you, don't go down that route where it's like, okay, hi, Ms. Jackson. So can you tell me about how it is with the medication, right? So that is basically an open-ended question, and it is motivational interviewing. But what you want to do is start from a place of just like a regular comment. Think of a blind date, right? So on a blind date, you're really trying to get to know the person. So you introduce yourself, and you want to hear about the person. Well, hopefully anyway, right? If you're interested. So basically it's like, hi, Miss Jackson, good to see you today. How are you doing? And can you tell me what brought you in today? What's going on with your asthma, all right? So you're leaving this question open so they can just go and tell you what's going on. And Miss Jackson can be like, well, everything was fine until this hot weather we've been experiencing, and I've had to use my pump more often, and I haven't been able to go to work. I've been calling out of work. And so now here's your response. Now you don't just keep piggybacking off with the questions. You tell Miss Jackson, wow, Miss Jackson, I'm sorry to hear that your asthma has been bothering you this much. But you know what? I'm glad you came in here today, right? So you're showing the empathy first, and then you're rewarding the fact that they came in. It's like, okay, you came in, you're being proactive. You want to reward them. And then you're going to say, you know what? And I'm glad you came in so we can work on this together. And then you understand? You're creating the partnership and you piggyback off of that. Okay, so Ms. Jackson, can you tell me, I see on your record based on Dr. Asthma Action Plan that you are on a controller medication. Can you tell me your experience with your controller medication? And you pass the mic. I call it pass the mic because you are not talking at that time. You are literally just allowing them to speak, and you are engaging with them with the, oh, okay, wow, okay, but you're doing it sincerely, where you're engaging with them and you're like listening, and then you can repeat back to what they're saying. Oh, Miss Jackson, so you mean to tell me that you're having a hard time with the ICS? Is that what I'm hearing? Is that correct? And then you let them just keep going, so you have a better idea of what direction to go. And this will actually let you know what angle to take with the asthma education. This will let you know, kind of like give you an idea of their the high of education they have, literacy. The more you let somebody talk, the patient talk, the more clues you get to how much work the patient will need as an educator, right? And so, and the patient will start to warm up to you because you are showing interest, actual interest, right? In the person, kind of like I said, like a first date. It's like, oh, okay, there's a connection, or this person feeling me, or whatever. But it's just, in a patient provider or educator relationship, we just want to make sure that there's some level of connection between the two, not just asking questions, that there's emotion behind it. And another thing that I want to mention behind motivational interviewing is the knowing, the understanding of emotional intelligence. And that's just another word for knowing how to read the room, just knowing when somebody's feeling you and how you feeling at that present moment, and identifying these two emotions and what to do with them. So, for example, if you are providing asthma education or you're asking motivational interview questions, and you're using these skills, and the patient is giving you the cold shoulder, like on the phone, fine, this can be frustrating. So you have to know how to read the room. So clearly they are not for the long education. They don't want to tell you their whole story, the whole history. So what you're gonna do is you have to put everything on the benefit of the patient. You know what, Ms. Jackson, I could tell that you're tired. And I saw that you've been here already. You had a long wait. You know what I'm gonna do? We're just gonna go over the inhaler technique. I really want to make sure that you get all of the medication that you need. So let's review technique and get you right out the door. All right. So know that you're doing everything in their benefit, because this is what's going to empower them. This is what's going to motivate them to stay, most likely to stay adherent to the treatment plan. Okay. So motivational interviewing is really meant to empower the patient. Once you get the information, it's just meant to empower them and motivate them. That's why it's called motivational interviewing. And so what folks, like professionals, when I do presentations, they'll ask if there is a standard motivational questions or a sheet or a check off. And honestly, you don't need this. You don't need a check off list of what to ask. it is something. It should just be something natural. Like I said, almost like you're on a first date. You not when you on a date, okay? You met somebody on Tinder, whatever. I don't know. I can't pronounce half these things, right? When you go on the date, you're not reading a sheet on the date, right? So you want something natural. So it's the same thing with the patient. We're not really looking for a sheet. You just want genuine conversation to abstract, get the juice that you need from the conversation, right? So get the information that you need. So and that's pretty much it. I think it's pretty simple. But I know it's hard. I have teammates that still struggle in this area because they're so used to asking those, okay, so is your asthma fine? Okay, so did you get your controller medication? Okay, so did you go to the ER? So this is something that a lot of us are used to. Yes or no questions. All right, guys. So I hope you learned something here today, guys, on motivational interviewing. I hope you are able to use this new skill, and leave a comment if you have used motivational interviewing. What works for you? Is it something that you specifically ask, or in a specific order that works for you? So please let me know. I'm just stating what I see and what I have used in the past, and what I personally have seen work with patients that I've dealt with as a respiratory therapist and a certified asthma educator, and the director of the asthma program. All right, guys. So I've been doing this for a little bit. So, but I'm always open to hear, what other folks are doing. All right, guys. So thank you so much for being here with me today. Please remember to like, share, subscribe once again on Google Podcasts and YouTube. All right, guys. And remember to invest in yourself and to only compete with yesterday's version of